My name is George du Toit. I'm a pediatric allergist at Guy's and St Thomas's Hospital and at the Evelina Children's Hospital. I've been asked to speak to you about antibiotic rashes, or rashes that come on at the time of taking an antibiotic. So this is a very common scenario as a pediatrician, and indeed all healthcare practitioners dealing with young children will encounter this. So obviously a child only gets an antibiotic when they're sick. Most infections in young children are either due to viruses or strep throats or common infections that also themselves commonly cause rashes. So it becomes very hard for the clinician sometimes to discern if a rash is caused by the antibiotic or the infection itself. There are a wide array of antibiotics and indeed rashes. The most common scenario we encounter are non-specific, nondescript rashes where the parents describe a flitting rash that comes on after 2 or 3 days, after a few doses of the antibiotic, that is not intensely pruritic or itchy, that is not associated with significant swelling of the lips or the mucosa or the lining of the eyes or urethra, anywhere where mucosal membranes are found. So the more benign rashes are easy to resolve. What we do is bring children into our clinic and we administer a 2-step dosage of the antibiotic. And there are many guidelines that now encourage this to be undertaken. A slight word of caution: if the rash is more significant, so it does affect the mucosal membranes, or if there are any systemic signs, in other words, wheezing or hypertension, which presents with children going pale, grey, floppy, or wheezy, or if there are other more troubling concerns, then you need to be cautious and should definitely be referred on to a specialist to deal with this. In that scenario, we will then perform skin prick testing, which is placing a drop of the antibiotic in dilutions on the skin and touching through with a lancet, and intradermal testing, where again we take the dilutions of these drugs and just put these into the dermis and see if a response is elicited. If that is negative, and there is a need for this antibiotic to be taken, if there's an underlying disease, for example, that does require this antibiotic, such as patients suffering with sickle cell disease or cystic fibrosis, then we need to take this further, and we will perform a drug provocation challenge where we give small incremental doses. If we are certain that the rash is due to the antibiotic and this antibiotic is urgently needed, we will then undertake desensitization. This is where we give small incremental doses of the antibiotic over some 12 hours until the antibiotic is tolerated. So to recap, most reactions to antibiotics are due to the bugs and not the antibiotics themselves. When we re-administer the antibiotic to children in a safe and supervised setting, 97% of children tolerate this quite happily, sometimes with some diarrhea, which is common in 10 to 15% of antibiotic courses, but nothing more untoward. And this is really reassuring because that patient can then, for the rest of their lives, take that antibiotic class. And as the amount of antibiotics available to treat the bugs that are increasingly becoming resistant decreases, it's an important question to know. Because if you live your life or your child is labeled with an antibiotic allergy, then the implications are for the rest of their life they will need to avoid that antibiotic class. And this can be a scary occurrence. For example, if the label is that of a amoxicillin allergy, you may be unlucky and your child develops a rash where a meningococcus or a severe infection is suspected, and you'll end up needing treatment late at night and you are not certain of which antibiotic they can take. This generates a lot of stress, and they will then need alternate antibiotics which come with different profiles, different efficacies and different side effects. So it's an important matter to sort out earlier in the child's life, in my opinion, and if the presenting symptoms are not severe or worrying, we can rapidly take you through to a drug provocation challenge. And again, 97% of these are negative. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you.